Smith? You're Zoe Smith?
Yes, I'm Zoe.
All right, well, my name is Kristen. I'm going to be your nurse today. So why
Okay.
don't you tell me a little bit about what brought you in here this morning?
Well, I'm here today because I've noticed that I'm a little short of breath, and that's not usual for me because I am a runner, and I get short of breath while I'm running sometimes.
Okay.
And then I also noticed that I've just been super tired, and it's not normal for me either to be that way.
Okay, so just kind of fatigued.
Yeah, I just don't feel like myself. And then I also noticed that when I pee, and I've looked at it, it stays really dark even if I, drink a lot of water or anything like that.
Yeah.
And then I also kind of look like I'm a little yellow tinted maybe, and that
Okay.
worries me a little bit. So I just thought I'd come in. I didn't know if there was something that was wrong or, what was happening, if it was normal. So I thought I'd come in.
Okay, yeah, you do look a little yellow to me, and those are obviously something that isn't normal in your body. So I'm really glad that you came in today. First, we're going to start out just doing, I'm going to get your vitals, and we're going to do a little bit of an assessment just to see where we're at, and then we'll let the doctor know, and she'll come in and talk to you, and we'll try and figure out what's going on, okay?
Okay.
So first, I just want to take your temperature. All right, I'm going to take your pulse. Okay. I see that you are running a slight temperature at 101, so that's something that I'm definitely going to tell the doctor.
Yeah, I didn't have a fever before I came.
Yeah, and your pulse is elevated as well at about 108. Are you usually on the high end, or do you know?
I'm usually about like 50 to 60, and they told me that that's because I'm a runner usually, so.
Oh, okay, yeah. I'm just going to take a listen to your heart too, just to see. Your heart sounds good. And your lungs sound clear to me. Okay. And then we're just going to do your blood pressure, which is coming in at about 120/40, which your chart told me that that's usually the place where you're at for that. I'm also just going to palpate your liver and spleen to see if they're enlarged. Okay, so take a deep breath in. And yeah, I am to feel your liver on that side, which is a bit, is not a normal finding.
Oh,
I'm just
no.
going to see your spleen as well. Okay, so both your spleen and your liver seem to be enlarged, which is not normal. So I'm going to relay this information to the doctor, and then she's going to come in and we can talk about, what she thinks may be going on.
Okay.
Doctor, do you think you could please come in to Zoe Smith's room, room 201?
All right, I'll be in there in just 2 minutes.
Okay, the doctor is on her way.
Hi, Zoe. How are you doing today?
Yeah, Zoe doesn't seem to be feeling too well today.
Oh, really?
Yeah, she came in complaining a little shortness of breath, some fatigue.
Okay.
Her skin is a little bit yellow.
Yeah, I do notice that.
Her
It's a little jaundiced.
Yeah, spleen and her liver seem to be enlarged.
Oh, wow.
She's running a slight temperature at 101, and her pulse is elevated at about 108.
Oh,
And she was saying when she urinates that her urine is a bit dark, she noticed, no matter what she's drinking.
okay. Well, I'm just looking at here at everything that you've told me and everything that you've written down here. And I think we're going to go ahead and do a blood test and a urine test just to make sure that everything's fine there.
Okay.
And just to figure out what's going on, okay? I don't want to say anything's wrong or anything like that, but we may have, a little infection or something like that going on, and we'll just check, okay?
Okay.
All right, well, so we'll go do that. I'm going to take your blood draws right now, and then we'll send them off to the lab, and we'll be right back.
All right, sounds good.
All
Why
right.
don't you do the labs and I'll...
All right, I'm going to take your labs. We have this idea in you since you were so tired coming in. All right, here we go here. All right. See, no harm, no foul. It doesn't hurt too bad. All right, I'm done with that, so you go ahead and just be back as soon as those lab values are in, okay? Alright, thank you very much. Alright, you're welcome. We'll be right back.